What is dry eye today in 2020? I'm here to explain to you what I understand as dry eye. What is important is diagnosing dry eye. We may know that 60% or 50% of patients experience dry eye, but the important thing is we need to diagnose it. What is the cause of dry eye? It's the modern day environment. We have situations with computer use, indoor environments with air conditioning that actually is driving dry eye disease. The important thing when we're dealing with patients with dry eye is to make sure they're satisfied. Patient satisfaction keeps patients coming back to you in a clinic situation, or if we're prescribing a treatment for dry eye disease, we need the patient involved and part of that process. Then they can be satisfied. What is driving dry eye? Is the environment. It is also some of the systemic medication we might use if we have allergies, if we have water retention issues such as diuretic use. We also have contact lenses. Every time we put a contact lens on the eye, we're disrupting the tear film and it causes dry eye. We have situations in clinics where we're doing cataract procedures or intraocular procedures. We need to diagnose dry eye disease before we do these procedures so that we can get the very best information before from the biometers to allow us to improve the outcomes and to choose those premium intraocular lenses that we are looking to provide our patients with. If we do LASIK surgery on the surface of the cornea or within the corneal area, we're actually affecting the corneal nerves, and that drives dry eye disease. We're doing more to cause dry eye than we are to solve it today. If we have a patient with glaucoma, in the UK we used glaucoma medications that have preservatives in, and that causes changes within the ocular surface that causes more dry eye. If we have thyroid conditions, if we have hormonal therapies such as menopausal treatments, or even the contraceptive pill, it is exaggerating that dry eye condition. We have everything coming together to get this explosion, an epidemic in dry eye disease. We have rheumatoid conditions, again, that cause dry eye disease, but perhaps the one thing that is universal is the environment today is a very dry, warm, indoor environment with a reduced blink rate, which actually then causes the dry eye disease to become more prevalent. Diabetic patients, again, increased risk of dry eye disease. Highlight an independent study from the MarketScopes research, which is looking at eye-related products from 2018. It's suggesting that the providers of therapy are really generating a lot of profit and income from dry eye disease, and it's exploding the amount of treatments and the value of these treatments, going from 4.6 billion through to 6.2 billion in 2018. So this is what we're seeing. But really, I believe that dry eye disease is underdiagnosed. We've got a lot of patients with symptoms, but we're not diagnosing the dry eye disease effectively. So one of the most important things I believe today is to have a diagnostic tool that helps us illustrate to our patients what the condition of the eye is. We have to have a tool that allows a whole portfolio of different diagnostic tests and then provide a report, not only to me as a clinician or another colleague within the profession, but more importantly to the patients. The public need to know the condition of their eye. A PDF report that is generated from the IDRA device from SBM Systemi provides patients with something they can understand. Once the patients understand the condition of the eye, they are actually more likely to comply with the therapies and keep coming back to the clinician or the provider of the therapy. SBM Systemi is based in Italy and is being proven one of the most advanced, innovative companies that provide a whole battery of tests in one device to allow the interpretation from a clinical point of view, but also from the patient's point of view. That all drives patient satisfaction, and it drives the compliance and the revenue for the patients. SBM as a company has actually driven risk management with regard to dry eye. It has a registration, class 1 registration, that assures you as either a clinician or a technician or a pharmacist that this is a safe product. This is something that has been validated, whether it's the OSA, the OSA Plus, or the new IDRA device. It gives you the security of knowing that the diagnostic package is safe and effective and simple to use.